All right, let's jump right in. For the longest time, we've talked about women's health as a social issue, right? A matter of fairness. But what if that's not the whole story? What if we've been framing it all wrong? What if the huge gaps in women's health care aren't just a social problem, but actually one of the biggest economic opportunities of our lifetime? Today, we are going to look at the data that completely reframes this entire conversation.
You know, it all really starts with this bizarre paradox that's hiding in plain sight in modern medicine. In pretty much every country on Earth, women live longer than men, often by 5, 6, even 7 years. So you'd think that means they're healthier, right? Well, that's where the story gets a whole lot more complicated.
And here is the number that just shatters that assumption: 25%. Women spend a full quarter more of their lives in poor health than men do. So yeah, they get more years, but a huge chunk of that extra time is spent dealing with pain, disability, and chronic illness. It really makes you stop and ask, what on earth is going on here?
Well, the thing is, this isn't some random quirk of biology. The research we're breaking down today makes a really powerful argument. This is a design failure. It's a fundamental flaw baked into the very architecture of our healthcare systems.
And this right here, this gets to the absolute heart of the problem. Our healthcare system is, incredible at prolonging life. It was built for emergencies, for treating those sudden, acute events like a heart attack or a major injury, things that historically define the male experience of disease. But where it falls down, where it really struggles, is in preserving function. It's just not good at managing those long-term, chronic, fluctuating conditions that affect women so much more.
So why? Why does this design failure even exist? Well, the root cause is actually shockingly simple. And it's been around for decades. The entire system was built using the wrong reference patient.
And wow, this slide just lays out that mismatch perfectly, doesn't it? The system was designed for the patient on the left, a straightforward, acute event in a standard male body. But the reality for millions of women is the profile on the right: chronic conditions like endometriosis or PCOS, years of fluctuating pain, and just a total loss of function long before they ever get a clear diagnosis. It's a system built for one reality, while half the population is living in a completely different one.
So what does this actually look like for a real person? Well, it looks like this diagnostic journey, a long, tangled, and incredibly frustrating path. For so many women, just getting a name for what's wrong can take years, sometimes even a decade. And along the way, they're misdiagnosed, or worse, they're told it's all in their head. The result isn't just suffering, it's a financial drain. More appointments, more useless tests, and higher costs, all for symptoms that never get solved.
And that brings us to the money. All those years of lost function, all that delayed care, it's not just a health issue. It adds up to a massive trillion-dollar blind spot in our global economy. Just look at this number. According to analysis from the World Economic Forum and McKinsey, if we could just close the women's health gap, we could add at least $1 trillion to the global economy. Every single year. That's more than the entire economy of a country like the Netherlands. And the crucial part is, this isn't about spending more money. It's about getting rid of the incredible inefficiency and waste that the current system creates.
So to really get where that trillion-dollar figure comes from, we have to talk about something called indirect costs. Usually, we think of healthcare costs as, hospital bills and prescriptions. But the real economic damage, that comes from lost productivity. People missing work, or showing up to work while sick and not being effective, or even seeing their careers stall out completely because of unmanaged health problems.
And here's the real kicker. The research is clear. In women's chronic conditions, indirect costs routinely exceed direct healthcare costs. Just let that sink in for a second. For every dollar spent at the doctor's office, we're losing several more dollars in economic productivity. That is the huge, invisible price tag we've all been paying without even realizing it.
Okay, so we've got a system that fails to keep people functional and creates these massive hidden costs. But believe it or not, it actually gets worse. The hard data shows we're literally paying more money for worse outcomes. It's a colossal efficiency problem.
Take a look at this. An analysis across 27 developed countries asked a really simple question. For every $100 we spend on healthcare, how many months of life expectancy do we buy? Well, for men, that $100 buys about 2.5 months of life. For women, just over 1.5 months. That's a 40% lower return on investment. The system is just fundamentally less efficient at turning our money into health for women.
And if you want to get even more specific, there's this metric economists use called the marginal cost of saving a life. It's basically how much extra you have to spend to prevent one more death. A really detailed study in Switzerland dug into this, and what they found is, well, it's pretty stunning.
So, in Switzerland, one of the best healthcare systems in the world, mind you, the cost to save a man's life was about 2.1 million Swiss francs. The cost to save a woman's life? 7.36 million.
I mean, just think about that, 3.5 times more expensive. And this has nothing to do with women's bodies being harder to treat. It's because the system is designed so poorly that it waits too long and intervenes in all the wrong ways, making every single thing we do less efficient and way, way more expensive down the line.
And that brings us right back to this idea of preserving function. Look at this chart. Conditions like endometriosis and PCOS, which are often dismissed as benign or not life-threatening, are responsible for over 5% of all the years lost to disability on the entire planet. That is a bigger chunk of human suffering and lost potential than HIV/AIDS, malaria, and tuberculosis combined. We literally fund a global war on those infectious diseases, yet we systematically ignore the very conditions that are quietly chipping away at the functional lives of half the population.
Okay, so the problem is crystal clear, the system is wildly inefficient, and the cost is staggering. But you know what? The great thing about a design failure is that you can redesign it. So let's talk about the blueprint for a better system, how we turn this failure into a new architecture for economic growth.
For governments, the roadmap is pretty straightforward. First, stop obsessing over lifespan and start measuring success by healthy life years. Are people living well? Second, put real money into the research and data systems we need to actually understand how diseases show up in women. And third, invest in early screening to catch problems before they become expensive, late-stage crises. This isn't just about better health. It's about a bigger tax base, a lower disability burden, and a much better return on every dollar spent.
And for insurance companies, this is a massive business opportunity. They can start by just auditing their own data to see how much money they are burning because of delayed diagnoses. Then they can redesign their plans to actually reward early detection instead of just paying for emergencies. And finally, they can use real data to price risk instead of using gender as a lazy and, frankly, wrong shortcut. This isn't just the right thing to do, it's just good business. It leads to more stable costs and a much bigger, more loyal customer base.
This quote from the research really just says it all, doesn't it? Women aren't a higher risk population, they're a misserved one. That whole story we've been told that women are just more expensive to care for, it gets the entire thing backward. The high costs aren't coming from the patient, they're a symptom of a broken system.
And that kind of leaves us with one last big question to think about. As our entire population gets older, the biggest health challenges are shifting away from acute events and towards those complex, chronic conditions that women have always been forced to deal with. So what if fixing this isn't just about women? What if designing a healthcare system that can finally serve women well is actually the ultimate stress test, the key to building a system that's truly ready for the future of medicine for all of us?